Today is World Pre-Eclampsia Day. It's a day to raise awareness about the pregnancy disorder to hopefully save the lives of expectant moms and unborn babies. Up to 7% of pregnant women will develop preeclampsia, and it is a serious pregnancy disorder that can affect both mom and unborn baby. It can develop quietly without a patient even being aware, so doctors say it is so important to monitor for symptoms, which includes swelling of the face and hands, headache that will not go away, seeing spots or changes in eyesight, pain in the upper abdomen or shoulder, and nausea or vomiting in the second half of pregnancy. Now, I spoke with a local OBGYN about this potentially life-threatening pregnancy complication. And Dr. Jamie Irwin, she works with Baylor Scott & White's Andrew Women's Hospital in Fort Worth, and says that early detection is important to prevent further complications, which can even include things like seizures and strokes.
Sometimes, though, a woman will just say, I just don't feel right. And we need to listen to that. We need, as providers, as doctors, we need to listen to them and trust that intuition. They know their bodies. They've lived in it their whole life. And it's on us to listen and to do testing, blood work, check the urine, check the blood pressure, be conservative, be cautious, and do what needs to happen to take good care of them.
Now, Dr. Irwin went on to say that there are some patients at higher risk of developing preeclampsia, and this includes someone with a personal or even family history of preeclampsia, someone carrying twins or other multiples, hypertension or diabetes patients, and first pregnancy folks. But some of the other risks include obesity, being over the age of 35, and being pregnant through IVF.
These high-risk women, it's recommended that they take an 81 milligram baby aspirin starting at 13 weeks and continuing that until they deliver. It's been shown to decrease the chance of developing preeclampsia.
Now, speak to your doctor before you add any medication to your regimen, but doctors say delivery is actually the cure to preeclampsia, and their goal is always to monitor the expectant mother closely and hopefully be able to get her and baby to 37 weeks gestation, which is full term, before delivering. It's also important to monitor patients closely after delivery because women who have preeclampsia during pregnancy are twice as likely to develop heart disease or even have a stroke later in life.